So, what's up? What's up? Let's have a discussion on this unfortunate, tragic story concerning Jessica Petway. She received a diagnosis of cervical cancer, stage 3. What possibly could have been avoided, according to her post that she posted on social media about what she was experiencing as far as symptoms, about what had happened to her, about the process of being misdiagnosed with fibroids, about this journey when she finally received the proper diagnosis. She was at stage 3. Sometimes we as women, we take it upon ourselves to make a phone call. I've done it, possibly to another woman. Women have sometimes even gone on social media. Now, when I do share experiences of my diagnosis of having an overactive bladder, interstitial cystitis, because there was a time when I did have a trans V ultrasound to see if I had fibroids. Yes, fibroids were detected, and the centimeters was extremely small. The way it was explained to me was the size of a grain of salt, meaning that wasn't what was causing my diagnosis of having an overactive bladder. But in Jessica Petway's situation, ladies, gentlemen, because you have a due diligence to yourself as well. You have an obligation to yourself as well. If we are living in a world where we have access available to medical care, preventative measures, diagnosis, how to, in my opinion, it's one of those things where things have to work together for the greater good. Not only can the patient be going to the doctor's office, going to see their primary care doctor, going to see their specialist, whether it's the oncologist because they have been diagnosed with cervical cancer, possibly through the OBGYN, the primary care doctor, to the urologist because they may have been diagnosed with prostate cancer. There are sometimes symptoms, but if you're going to a healthcare professional and you're telling them what is going on, what is being missed, you sometimes hear Black women are overlooked. I wouldn't doubt that. You sometimes hear women are overlooked. The elderly are overlooked. Oh, let's just base it on age. You're getting older. Oh, you're just a woman. It's all in your head. Oh, excuse me. Like, I have been in some doctor's offices where the doctor has said, oh, excuse me, I have another phone call. Excuse me, I have another. One time, this particular doctor, he had a total of 3 phone calls. There's no way I was going to let this doctor do any form of care dealing with me. My thing is, you want to have a comfort level. You want to be able to point out a good doctor. You want to go off of that intuition. You want to go off of those bedside manners. Now, if it's just a particular script or a particular test that maybe this doctor does, fine. I was okay with that. But the thing is, okay, I still have to be under this doctor's care if he writes the prescription for that particular medication. Then you have guidelines. Who makes up these guidelines? But this doctor talks about it. She said guidelines are advice, because I've been told, well, you don't need to get a pap smear.
Of the cervix is going to look like a mass at the level of the cervix. And I'm certain it was probably growing in this situation. Yeah. It was bleeding, and all it needed was a pap, a swab. Ultimately, she had a biopsy of the mass that determined that it was cervical cancer.
And she found out at that visit.
Yes.
It was determined at that visit. It wasn't like she had to go home and wait.
The person looked, and she said in her account, she says, finally the doctor said, can I just take a look? And I'm saying,
Can
I'm
I
reading
take
this,
a look?
and I'm like,
Why
didn't
weren't you looking
anyone look?
before, right?
Oh my God.
Well, okay. So one thing is, I know a lot of guidelines say, oh, only get a PAP every 2 years.
Right.
Yes.
Only get a PAP every 3 years. I don't feel comfortable with that. Can I go to my doctor and say, I need one every year?
Yes.
Every time I come to see you for my annual, I need a PAP.
Yes, now let's back up. The cervical cancer screening guidelines changed some years ago from having yearly PAPs. First they went to every 2 years, and now they're saying we can do PAPs every 3 to 5 years with HPV co-testing.
Okay.
That is because cervical cancer and precancer moves really slowly. I mean, it's like the snail of cancers.
Do you stop getting pap smears? Because by time you're in another age category, 70, 60, late 60s, 70s, 80s, don't trust what I'm saying. Ask your health care provider, because sometimes I have heard of women still going to get pap smears and they're no longer even in the age range, but everyone's different. You may have a diagnosis of sort that requires you to still get pap smears beyond the age of X, Y, Z. It becomes a notion of advocating for yourself, learning all that you can to be able to have your mind guarded on what does not make sense, what the doctor is saying, meaning go get a second opinion, compare that opinion, go get a third opinion if need be. Protecting, guarding your household, your husband, the guy that you're in a relationship, your good friend, your uncle, your cousin who is male. Okay, I'm talking about the prostate now. If they're having such symptoms, same thing. There's guidelines for them. Urgency, frequency, that may be out of the norm. When they use the bathroom, are they not only, well, I don't want to go that far, but there are guidelines to this that we have to be aware of and know that we know and trust that we have a good doctor, but to never be afraid to ask questions, to advocate, because anytime a doctor, because sometimes, you know what, it seems like this. Sometimes it seems like it's almost this really weird secret society that it's like, what are you keeping from me? But then you'll find out that you'll be so blessed from the time you make your appointment or your follow-up appointment from front desk, or by the time you get to the back room and you're having your vitals taken, giving your chief complaint, the reason for your visit. And I have been blessed in situations where the nurse, the assistant, has told me something that they probably shouldn't have told me, but maybe I was already thinking, but then they confirmed it. To be aware of this particular doctor, I've had that to happen. I'm thankful for that. And let me tell y'all, I've seen, that's why we need more Black doctors. We need good doctors, period. I don't care what color a good doctor is, a good doctor. We need more female good doctors. I don't care, male or female. If you are a good doctor, get to know what a good doctor is. And sometimes it's just followed off of intuition. Discuss your symptoms. If you have a really good supportive system, as far as if it's your daughter who is of age to share things with, get her opinion on things, because what happens is if your health is affected, it's going to affect your daughter who's of age, your son who's of age, the guy you're dating, your companion, your husband, your aunt, your parents. It's going to affect the family. If you feel comfortable enough to share what's going on with you, get their input. Sometimes you can find out easily too who are good doctors. Get in the groups. There are social media groups that will let you know sometimes that's not a good doctor. This has been my experience. Yelp, I've used that before, but I just say I've had better experiences getting in the social media groups and asking questions, observing, reading. So when a particular doctor mentions certain things, I'm kind of like, okay, let me ask this question to see what their response is. Our health is so important. Our health, our mental state is so important. Our physical state is so important. And what we learn, again, we're able to pass down to the next woman. Okay? What we learn, we're also to help the next person, period, male or female. But it's about the information. We have to be informed. We have to be equipped. We have to almost know more than just going in as a blind sheep. As a blind sheep, just hanging on every possible word. Sometimes we even have to go so far as to say, can you do a trans V ultrasound? Can you do an ultrasound? Can you take a look? How do you know that without a visual or an x-ray or just doing the lab work aspect? How do you know? Where is that possible expectation or that number coming from? What are we looking at? What are we basing this diagnosis off of? Just because the patient is telling you, I'm having this form of discharge. Okay, can we have a test possibly to support this?
Prove that I'm safe.
Right.
Show me the data. Where is my PAP? Like, what is the result? If I have fibroids and you say, oh, that's normal, well, let's follow them and make sure they're not growing excessively, because fibroids can be cancerous too. Now, very, very rarely, less than 0.1% of fibroids are cancer.
Okay.
Most fibroids are benign, and most people will get fibroids. This is actually a sign or an image of fibroids. They can be in various locations and they can look, very large. They can even look kind of ominous, but you want to make sure that you're following them to make sure that they're not, growing excessively. You're not bleeding excessively. But
is this available for the year that we're living in? So those who know you're overdue for certain tests, maybe this is the moment possibly to encourage you, get that taken care of. It matters. You matter. We matter. We matter.